Hello everyone, welcome to this channel Ghost Biology. In this video we are going to talk about Guillain-Barré Syndrome or GBS, a rare but serious neurological disorder. So imagine waking up one morning and realizing your legs are feel weaker than usual. We ignore it, thinking it's just fatigue, but by the evening you struggle to walk. Within days you lose control over your arms, and soon even breathing becomes difficult. What's happening? This is Guillain-Barré Syndrome, or GBS, a rare but serious disorder where your own immune system attacks your nerves. What triggers it? How does it progress? And is there a cure? Let's explore the fascinating and mysterious world of GBS. So, what is GBS? Our body's immune system is like an army, constantly fighting off invaders like bacteria and viruses, but sometimes it makes a deadly mistake. In Guillain-Barré syndrome, the immune system mistakenly attacks the body's own peripheral nerves, damaging their protective covering, the myelin sheaths. Without this insulation, nerve signals slow down or stop entirely. This leads to weakness, numbness, and in severe cases, complete paralysis. But why does the immune system turn against us? Scientists are still searching for the answers. Did you know that Guillain-Barré syndrome isn't just one single condition? It actually has multiple variants, each affecting the nervous system in slightly different ways. Understanding these differences is crucial for proper diagnosis and treatment. So, in the types of GBS, we have first AIDP, acute inflammatory demyelinating polyneuropathy. This is the most common form, especially in Western countries. It starts with weakness in the legs that gradually spreads upward. The immune system attacks the myelin sheath, disrupting nerve signals. The second type's AMAN, acute motor axonal neuropathy. This type is more prevalent in Asia and South America. Unlike AIDP, AMAN directly attacks motor nerve axons, leading to more severe paralysis but with fewer sensory issues. The third type's AMSAN, acute motor and sensory axonal neuropathy, a more aggressive form that damages both motor and sensory nerves. This variant is rare but has a slower recovery process compared to others. And the last one, Miller-Fisher syndrome or MFS, a rare variant that primarily affects coordination, eye movement, and reflexes. Interestingly, many MFS cases start with double vision and loss of balance rather than muscle weakness. So here's the curious fact regarding this GBS variant. While ADP is most common in Western countries, AMN and AMSN variants are more frequently reported in Asia. Scientists are still investigating why this regional difference exists. So different GBS variants can affect individuals in unique ways, making early detection and personalized treatment essential. Knowing the symptoms and the type of GBS at play can significantly improve patient outcomes. So why the GBS is important? You might be wondering, why should we care about such a rare disease? Well, here's the catch. GBS can affect anyone, at any age, at any time. Though rare, it can progress shockingly fast, leaving people completely paralyzed within days. If the paralysis reaches the muscles responsible for breathing, it can be life-threatening. In recent years, rising GBS cases linked to viral infections have caught the attention of doctors worldwide. Could a common virus be triggering a deadly disease? Let's investigate. So, how the GBS develops? Imagine a phone charger cable with its outer insulation stripped away. The wires inside become exposed, making it difficult for electricity to flow properly. This is exactly what happens in GBS. Your nerves are like electrical wires sending signals from the brain to the muscles. But when the immune system mistakenly attacks the myelin sheath, those signals slow down or stop completely. This leads to progressive muscle weakness. But what triggers this deadly confusion in the immune system? Let's dive into the causes. So, the possible triggers. GBS is still a medical mystery, but research has uncovered some strong suspects behind its cause. The biggest trigger? Infections. Around 60% of GBS cases follow bacterial or viral infection. The most notorious culprit is Campylobacter jejuni, a bacteria found in undercooked poultry. Viral infections like influenza, COVID-19, Zika, and HMPV have also been linked to GBS. But here's where it gets more complex. While some cases have occurred after vaccinations, scientists emphasize that the risk is extremely low compared to the risk posed by infections themselves. So, who's most vulnerable to GBS? Let's find out. So, who is at risk? GBS can strike anyone, but certain groups are more at risk. The first is age matters. While GBS can occur at any age, it is more common in adults over 50. Men are slightly more prone than women. People recovering from infections, especially gastrointestinal or respiratory infections, are at higher risk. However, because GBS is unpredictable, even young and healthy individuals can develop it. The question is, how do we recognize its early warning signs? So, the early symptoms. GBS often starts quietly, but within days, it can turn life threatening. The first warning signs: a tingling sensation in the hands, feet, or face, muscle weakness starting in the legs and spreading upwards, difficulty walking or balancing. At first, these symptoms may seem mild, like fatigue or a bad flu, but within days or even hours, GBS can escalate. In the advanced symptoms, as GBS progresses, symptoms become severe. Weakness spreads upwards, from legs to arms, then to the face. Some patients lose reflexes completely. In extreme cases, the paralysis reaches the diaphragm, the muscle that controls breathing. At this point, a ventilator may be needed to keep the person alive. This rapid progression makes early diagnosis and treatment crucial. But how do doctors confirm GBS? So, how is GBS diagnosed? Since Guillain-Barré syndrome progresses rapidly, early and accurate diagnosis is critical. But there's no single test to confirm it. So, how do doctors detect GBS? The step one is clinical examination, clinical symptoms, and neurological examinations. Doctors check for classical signs like muscle weakness, loss of reflexes, and tingling sensations. And then in the medical tests, we have the step 2 lumbar puncture or a spinal tap. A small amount of cerebrospinal fluid CSF is extracted to check for elevated protein levels, a key marker for GBS. And the step 3 is nerve conduction tests like EMG and NCS. These tests measure how fast electrical signals travel through the nerves. If the signals are slow or blocked, it confirms nerve damage. Once diagnosed, how do we treat GBS? Let's find out. There's no direct cure for Guillain-Barré syndrome, but early treatment can dramatically improve recovery. Plasma exchange, plasmapheresis. This technique removes harmful antibodies from the blood, stopping further nerve damage. The second, intravenous immunoglobulin (IVIG). High doses of healthy antibodies are infused into the body, helping to regulate the immune response. Third, supportive care. In severe cases, patients need a ventilator to breathe. Physiotherapy helps regain strength, while pain management eases discomfort. But here's the big question: do people fully recover? So, what happens after GBS? The road to recovery from Guillain-Barré syndrome is different for everyone. 80% of patients make a full recovery within 6 months to 2 years. But for some, weakness and fatigue persists for years. Around 5 to 10% experience permanent nerve damage leading to lifelong mobility issues. Rehabilitation, including physical therapy and strength training is crucial. But what if someone develops GBS again? Is it possible? So the good news, GBS rarely recurs. Only about 3 to 5% cases experience a relapse. However, some people develop chronic inflammatory demyelinating polyneuropathy CIDP, a long-term nerve condition that looks like GBS but progresses slowly. This is why regular follow-ups with the neurologists are important, especially if some symptoms return. Now let's clear up some common misconceptions about GBS. Here's about some myths and some facts. Like many medical conditions, Guillain-Barré syndrome is surrounded by myths and misinformation. Let's past some common myths. The first myth is GBS is contagious. While the fact is GBS is an autoimmune disorder, not an infectious disease. You can't catch it from another person. GBS always leads to permanent paralysis. Well, the fact is, most people recover fully or partially with proper treatment, although some may experience lingering weakness. The third myth, only elderly people gets GBS. While the fact is different, GBS can affect people of all ages, including children and young adults. So spreading accurate information is just as important as medical treatment. So if you hear misinformations, correct it and help raise awareness. The real way to protect yourself, prevention and early awareness. So can GBS be prevented? Since infections increase the risk of GBS, the best prevention strategy is staying healthy. First way is practice good hygiene. Washing hands and handling food safely reduces the risk of infections like Campylobacter jejuni. Second, stay vaccinated. While GBS after vaccination is rare, preventing infections like flu and COVID-19 lowers your overall risk. Third, boost your immune system. Eating a balanced diet, staying active, and getting enough rest reduces the likelihood of immune dysfunctions. But here's something fascinating. GBS trends are changing globally. Why? As the Indians' recent GBS cases, Guillain-Barré syndrome has been making headlines in India recently, with a surge in reported cases across different states. But what's causing this sudden spike? Experts suggest a strong link between GBS and recent viral infections, including respiratory illness like HMPV and even post-COVID complications. Some cases have been reported following vaccinations, but scientific studies show that such occurrences are extremely rare. Why does this matter? Because awareness leads to early detection. The sooner we recognize the symptoms, the better the chances of recovery. Doctors and healthcare professionals across India are closely monitoring these cases, emphasizing the importance of rapid diagnosis and interventions. If you or someone you know experiences unusual weakness, tingling sensations, or difficulty moving, consult a doctor immediately. Timely treatment can make all the difference. Let's stay informed and take charge of our health. GBS isn't just a concern in India, it's a global phenomenon that has puzzled scientists for decades. Historical records show that outbreaks of GBS have often followed major viral epidemics. In the past decade, GBS cases have been increasing, and scientists are investigating why. Since the COVID-19 pandemic, cases of GBS rose in some regions, possibly due to post-viral immune responses. Developing countries report higher GBS cases, likely due to greater exposure to bacterial infections like Campylobacter. Ongoing research is exploring whether genetic factors make some people more vulnerable to GBS. Could we one day predict who might develop it? Only time will tell. In 1976, an increase in GBS cases was linked to the swine flu vaccine, raising concerns about vaccine safety. However, modern research has shown that the risks are minimal compared to the benefits. In 2015-16, the Zika virus outbreak in Brazil led to a significant rise in GBS cases, proving the strong connection between viral infections and autoimmune reactions. Recent COVID-19 studies suggest that some patients develop GBS as a post-viral complication, reinforcing the need for long-term neurological research. These cases remind us of how crucial it is to invest in medical research, surveillance, and public awareness. Every discovery brings us closer to understanding and managing these complex conditions. So, how to stay informed? In today's digital world, there's a flood of medical information, but not all of it is reliable. So, where should you look for accurate, science backed information on Guillain-Barré syndrome? The first is WHO, World Health Organization, Global Research Outbreak Tracking and Treatment Guidelines. Second, Centers for Disease Control and Prevention, CDC, trusted public health information and case studies. There's others like National Institutes of Health, NIH, scientific studies, ongoing research and clinical trials. Government health departments, country-specific resources, hospital listing, and emergency contacts. If you are interested in real patient experiences, support groups and forums can provide valuable insights. But remember, always verify information with healthcare professionals before making medical decisions. So here's some misdiagnosis and challenges. Guillain-Barré syndrome may be rare, but awareness can save lives. Some common misdiagnoses are stroke, multiple sclerosis, myasthenia gravis. But it is important to early diagnosis. Recognizing early symptoms and seeking immediate treatment reduces complications. Supporting GBS research helps scientists uncover better treatments and a possible cure. Resources are available for patients, caregivers, and medical professionals. So share this knowledge. If you found this video helpful, spread the word. Subscribe and let's raise awareness about this fascinating yet serious disorder. Thank you for watching. Stay curious, stay informed. Until next time.